Hello guys, Assalamu alaikum. I hope you will be fine. My name is MD Mahabub. Today we will discuss the basic of skin cancer. There was once a time when cancer was a disease that was considered rare and some things that was almost unheard of for most people. Today the doctors contract a growing number of people who are being affected by the same. What a alarming is that there are so many types of cancer this day and that many times detecting them becomes a thought task. One of the most common types of cancer incarnated this day is skin cancer, and in most cases the reason behind the same is that people are not taking care of themselves and are not being sun safe. What is important to remember is that if the skin cancer is dedicated within time, it can be treated and even cured. What is skin cancer? When there is an uncontrolled growing of skin cells that are not normal, it is unknown as skin cancer. This, this type of cancer occurs when DNA of skin cells get damaged and has not been repaired. This leads to mutation, genetic defects, and could also lead to tumor and malignancy. The skin cancer need to be treated immediately. If the condition is detected in its initial stage, it is relatively easy to treat the cancer and to even eradicate it completely. In addition, early detection will also ensure that the condition does not spread to their parts of the body. In order to receive early treatment, it is important that you learn how to examine your skin, which in turn will ensure that you are able to detect the conditions well in advance. What are the type of cancers? In order to treat skin cancer, figuring out the type of cancer is the most crucial step of all. There are actually three types of skin cancer: basal cell carcinoma (BCC). This is perhaps the most common type of skin cancer and is actually much more frequent as compared to the other types of skin cancer. This type of skin arises from the basal cells, which are actually present in the deepest layers of the epidermis. The initial presentations might be in the form of a bump or shear that does not heal. It could also present in the form of a patch of skin which is red and irritated. Most of the times, the areas of the skin that are constantly exposed to sunlight, such as face, ears, and scapulae, are affected by basal cell carcinoma. If the condition is diagnosed well in time, treating and curing it is possible. Squamous cell carcinoma (SCC). Initiating in the squamous cells, these types of cancer to infect in the epidermis. The condition may present itself in the form of skin crusting to scaling. There could become red and inflamed, and there could be bumps which do not heal. While the condition is seen most commonly in areas which are constantly exposed to sunlight, it could actually manifest itself in any part of the body. With early treatment, the condition can be stopped from spreading. Melanoma. This is the most dangerous type of skin cancer arising from the pigmented skin cells. If the condition is not diagnosed within time, it would lead to death. However, this type of cancer can be treated and cured with minor surgeries. But if the melanoma starts and spread within the body, then curing it can be quite the thought risks. What are the main treatment for skin cancer? If the condition has been dedicated well within time, there are curtain protectors and treatments which can cure the cancer. Some of the most commonly used procedures include wide local excision. The tumor is removed using surgery and a small protection of these tissues. Shredding the tumor is also removed. Mohs surgery. The skin cancer is removed in a very precise manner. Cryosurgery. The tumor is destroyed using cold treatment. Laser surgery. The cancer cells are vaporized using laser. Curating and disconnection. The skin cancer is removed by methods such as scalping and cauterization. Topical chemotherapy. Prescribed medications in the form of lotion, uh, lotion or creams will have to be applied on the skin where the cancer is manifested itself. Laser treatments for precancerous growthing. A laser is used to remove the skin condition that would eventually develop into skin cancer. photodynamic therapy are per considers growth, especially medications known as um, known as fertilization agents are combined with light therapy, and these are utilized for the eradications and defective cells. There are the main dose and doesn't. Where Here are the things that you should do. Try to minimize the time you spend in the sun, especially between 10 in the morning and 2 in the afternoon, which is when the rays of the sun are the strongest. Wear clothing that will offer protection against the sun, including sunglasses and hats with wide brims. Make sure that you use sunscreen on a regular basis and pack one that will offer your protection against UVA as well as UVB. Avoid artificial tanning beds and tanning devices as much as possible. Learning how to recognize it as A, B, C, D, E, S of skin cancer lessons. Number A. For asymmetry. B for border irregularity. C for color variability. D for diameter increases. E for evolving nature. If you notice any skin lesions more or moles, then it would be best that you visit a dermatologist immediately. Here are the things you should avoid doing. If you noticed any signs of skin cancer, do not ignore them and make sure that you have them scanned by a doctor rather than going to a general practitioner. It would make sense to meet a dermatologist because they would be able to offer better advice. If the condition is diagnosed as skin cancer, do not delay away from asking questions and further treatment. Thank you so much guys for watching this video.